Hello again, it's Dr. B with Functional Minute. Today I want to talk to you about anxiety. Do you have difficulties with anxiety? Are you having a hard time coping with anxiety? We do see a lot of patients with anxiety, and it's become such a common problem in today's society, especially with all the stresses that we have. Just like this weed eater in the background, that really doesn't help our video, but we're going to do our best today. Anyway, one of the things we see with anxiety are a lot of medication intake. You know, as I say, anxiety is not a Xanax deficiency. You know, there are some causes, there are some things that predispose patients to anxiety. And so what is anxiety? Anxiety is basically a sense of being overwhelmed, a sense of powerlessness. And it can overcome people. People can have panic attacks, anxiety attacks, or just generally be anxious throughout the day with any kind of stress that hits them. Today I want to talk to you about how I typically address anxiety in our office. One of the big things we stress is sleep and food first and foremost. Sleep, as we talked about in our last video, is extremely important. You burn off certain hormones, you regulate certain hormones in your sleep, and you actually repair your mind and body during sleep. I always recommend at least 8 hours a night. Everybody's different, but you can't really go wrong with getting 8 hours a night. Typically as many hours before 12 as possible, because how your hormones are regulated throughout the night. And so getting good sleep is really important. The next thing is food. Food is the thing that we put in our bodies every day. It's the number one thing we're exposed to on a consistent basis. Today's society, we eat so many processed foods, a lot of sugar, a lot of wheat and gluten products, a lot of processed stuff that really affects our bodies. If you really look on a label and a lot of these boxed and canned foods, and some of the stuff you can't even pronounce. And is this stuff good for us? And with all the anxiety and depression and chronic illness that we're seeing today, could some of these things be contributing to it? It's tough to tell, but they definitely don't help. So really getting back to a whole foods kind of dietary plan is important. You can even take your weed eater out back and cut down some vegetables if you need. Anyway, and so food is definitely important. We talked about gluten-free in the past, which is definitely important. Gluten and wheat are typically high glycemic index, so they can kick up your sugars, which leads to anxiety problems. And so that's definitely something to look at when it comes to food. Another thing is exercise. Low-level exercise, not high-intensity exercise, but low-level exercise is definitely good to help deal with stress. You help burn off that excess cortisol that you have in your system with stress. And so low-level exercise on a daily basis or every other day is definitely good. A nice light walk outside is good, and exposure to sunlight and fresh air is always good as well. Another little thing I recommend is detox baths. Typically you can get a nice hot bath at night is the best time to do it. You could do a couple cups of Epsom salts, some baking soda, about a cup of baking soda, and some lavender oil. Put that in there and stay in there for about 20 to 30 minutes, and it will pull out toxins out of your body and also provide some magnesium that will absorb into your body and help with anxiety and stress. Another big thing is breathing. We talk about breathing exercises with our patients. A good way to think about breathing and how it affects your body is a good breathing program helps stimulate your parasympathetic nervous system. Your parasympathetic nervous system is your rest and digest part of your internal nervous system. And so it does help calm you. So typically breathing in 4 to 5 seconds, holding it for a couple seconds, then breathing out for about 7 seconds. And doing that a couple times throughout the day is a great way to help with stress, and it definitely calms down your stress experience and anxiety experience. When it comes to supplements, there are certain ones that I've recommended in the past, which we recommend for most patients with anxiety. One is L-theanine. Typically an L-theanine dose of about 200 milligrams at a time. You can do it up to 3 to 4 times a day is a great way to help with anxiety. L-theanine is found in green tea, as we talked about before. Another one is GABA. GABA is a substance that acts on the GABA receptors in your brain. These GABA receptors are the ones that help deal with anxiety. GABA at about 50 to 300 milligrams a couple times a day is great for anxiety as well. The biggest one we recommend is magnesium. Magnesium at about 250 to 500 milligrams overall daily or twice a day is great. Sometimes when you couple it with calcium, it's a great supplement to have for digestive wellness and anxiety. Some of your adrenal supplement hormones are good. Ashwagandha is a great supplement to help with that. Rhodiola is a great supplement to help with adrenal functioning. These help regulate the adrenal glands to help you deal with stress. Another one is passion flower and valerian root. We recommend this for sleep at night because they can have some sedating effects, but those two supplements are definitely good for anxiety. Typically about a 200 to 300 milligrams a couple times a day is quite effective. And then one of the supplements we have in our office called Pure Focus has multiple supplements or multiple vitamins and minerals in it that help calm the mind. It's good for ADD, ADHD, and anxiety. And that's something you can get through our office. But it's a cherry flavored powder, which is pretty effective and tastes really good. So anyway, thanks for joining us again. Please feel free to comment at the bottom of our page, and we'll be happy to help you out as best we can. Thanks.